Hi there. Thanks for joining the ward medication round. As you're in stage 1, I've only allocated one patient to you, Verna MacDonald. She's 85 years old and she was admitted overnight from A&E with syncope due to postural hypertension. She also suffered a fall but had no injuries noted. She's an inpatient for further investigation and she'll be transferring to cardiology as soon as a bed becomes available. This morning, I'd like you to administer her morning medicines. Verna's on bed 10 in Bay 3. Her drug chart, news chart, and other nursing charts are on her bedside, and her medical notes are at the nurse's station. Verna's own medicines are in the locked cupboard by her bedside, and the rest of the medicines are in the trolley. If you have questions, just come and find me.
Joan Weston, last time I checked. Born 20th of October 1943.
That's fine, dear. It is my name, after all. I've been Joan all my life.
I'm Yasmin Begum, born 1st January 1945. Yes, that's fine. Thank you, nurse.
I am Vera McNulty, born 3rd of February 1933. Yes, okay, nurse.
I'm Verna MacDonald, born 2nd of March 1933.
Yes, that's fine, dear.
Sure, go ahead.
Yes, I am. Penicillin. Oh, it goes back years, dear. I think I was about 16 at the time.
My mother said my tongue swelled up and I started to breathe really fast and I collapsed. I was in intensive care for 2 days. I've never had penicillin again, I don't think.
Yes, that's okay, dear. Go ahead.
Yes? The doctor from the emergency area said my heart was very slow yesterday, and so they gave me some medicine for it. I felt much better afterwards. Not too bad, actually. I just have this pain in my hip. Do you think you could give me some more pain relief for it? These look different to the tablets I normally take. What are they all for? I don't feel well. Can someone please help me? I feel really
I'll
strange
take
and
over
dizzy.
now, nurse. Please go and wait in the office.
Oh dear, not again.
How exciting. Just like on TV.
Looks like she's going to be sick. I better get them up.